Good morning, everyone. Thank you very much for joining me on the for this webinar on menopause. So my name is Dr. Amelia Evans. I'm one of the occupational health physicians with Insight. And the reason why I'm giving this talk today is because I did a menopause online course recently and found it, to say the least, very eye-opening, and it's now become a topic I'm very passionate about. So hopefully, by dispelling some myths with you today, everyone will feel a little bit more empowered with the information I want to give to both employees, managers, and staff members. Now, the reason why menopause is so topical at the moment is, it's existed for as long as women have, but the reason why it's become more prevalent is because as we innovate as humans, technology gets better, healthcare gets better, we live for longer. Women are now experiencing menopause for a third, if not as much as a sort of half of their life, because menopause kicks in around middle-aged. That's obviously a sweeping statement, but generally. So when back in the old age, dark ages, women and men would only live till 40s, 50s if you were lucky, whereas now we're living to up to 100 years old or more. And so menopause is around for a lot longer. Hence why it's being recognised now. So with this presentation today, I'm going to be covering a little bit about the physiology and pathophysiology of menopause, what complications can arise in menopause, treatment, the role of hormones, and also, most importantly, how it fits in with work. So as you can see here, these are some of the points that we're going to be covering. So here is the gynecological system of the female, and with menopause, throughout the life, the sort of period and menstrual cycle is run by three main hormones: estrogen, progesterone, and testosterone, each having their own role within the cycle. And as women start to become perimenopausal, the hormones begin to decline, but it isn't a sort of nice gradual decline. When they actually did a trial or study and took multiple blood tests of these women over a long period of time, over a decade, they found that, yes, it was a nice curve sloping downwards. It was very labile, and these levels of hormones fluctuated, which explains why some of these menopausal symptoms can be so unpredictable in nature and vary in severity over periods of time, so either days to weeks to months. So at the build-up to menopause, women enter the perimenopausal phase, and that can be up to 8 to 10 years long. It's not something that happens suddenly. Now, with menopause, the definition is that women will enter menopause when they haven't had a period for 365 days, so 1 whole year, and thereafter they go through the postmenopausal stage. Now, the average age of menopause is around age 51, but actually there is women who get some early onset menopause when it occurs below the age of 40, 45, and then you also have something called primary ovarian insufficiency, where a woman might have an adverse reaction to medication, or most commonly have a hysterectomy where the ovaries and uterus are removed. So instantly they have a drop of estrogen and progesterone, which then causes them to hit menopause as it can be as young as 14. So this is by no means just a middle-aged problem. It can happen at any age. Now, a bit of a fact or statistic here, that 1 in 100 women can experience menopause before the age of 40, and as I alluded to earlier, this is known as premature menopause. Now, how does the reduction of estrogen affect a woman's body? It has multiple effects, not just affecting the gynecological system, but actually everywhere, because although there isn't a diagram here, there is a really, really good depiction of how widespread the estrogen receptors are. They're in almost covering most cells of the body, most organs, from the brain to the liver to the gastrointestinal system. And if you have estrogen and progesterone and testosterone all reducing in volume circulating around the blood, then this can have a really widespread effect, which gives rise to such a variety in symptoms. So one of the symptoms can be poor sleep, the hot flushes, but also women can suddenly get really, really cold as well. It's real fluctuation. It also can affect mental health because it has an impact on the dopamine and serotonin receptors. Consequently, yes, can lead to low mood or even depression. And it also can have effect on the skin and it's a dermatological impact as well. And a lot of women will have local effects as well as systemic effects. So this really has quite a global impact. The slide here states that 51% of the population are women, and that women have to sadly leave work because of menopause. 50% take time off using the excuse as tummy bugs, which I think is most sad of all, because menopause really has quite a stigma around it and a taboo subject, and it really shouldn't be. It affects every single woman at some point in their life and really must not be underestimated, the severity of these symptoms that can affect women at any age. Although it says here there's 38 symptoms of menopause, I think that's an arbitrary number because it could be a lot more than that. We just haven't documented them. And what we'll go through now, the range here, as you can see, so to my point earlier about estrogen affecting multiple systems in the body, can give rise to this variety in symptoms. You've got hot flushes, night sweats, migraines, dizziness, breast pain, bladder incontinence, bloating, you've got fatigue, poor sleep. So you've got a huge variety there, and no woman will experience all of them. There'll be, again, a further variety between women and women, which is why when we're addressing this in the workplace, it must be an individualized approach. Now, with the mental health impact of menopause, that is also sort of misdiagnosed as clinical depression, and actually it isn't caused from any other reason apart from menopause, because you've got this reduction in estrogen, testosterone, and that has effect on serotonin, dopamine. So I think there was a statistic saying there's millions wasted in the NHS of GPs inappropriately prescribing antidepressants to females with clinical depression, but actually if you were to do a blood test, you'd notice that they had low estrogen or testosterone levels, and all they needed was hormone replacement therapy rather than antidepressants. So if this is going to be sort of more combated appropriately and effectively, this is recognised in the workplace, hopefully it'll filter through and percolate into the medical world as well. And so we no longer start giving these women antidepressants, which won't address the cause, but instead HRT, and actually boost their work efficacy, boost their mood, and overall boost the workplace. So these are some of the symptoms that menopause can give rise to: mood swings, lack of energy, brain fog, sadness, lack of motivation. Also memory is an issue as well, to the point where some women get so frightened that they have early onset dementia. But actually, if you were to take a proper look at their testosterone levels, it's because they're low rather than anything else. So you can see here that there's a plethora of symptoms that can be all down to these low levels of hormones that play a pivotal role in the daily function of females. Now, some complications that are not well known if menopause goes untreated. And here I like to use an analogy similar to hypothyroidism, also known as an underactive thyroid. If you have a female or male who complain of feeling cold, they've lost the outer third of their eyebrow, everything's slowed down, they have low mood, low energy levels, then chances are the GP will run a few blood tests and find that they have low thyroxine levels. And this thyroxine is a hormone that is produced by the thyroid. And because they've got low thyroxine, the obvious treatment is to give them thyroxine as a medication, boost those thyroxine levels back up to normal, and find that actually those symptoms go away. So the way I like to see menopause is a woman in a sort of hypoestrogen state, but also low progesterone and testosterone with it. And it reflects a very similar situation, that they've had these hormones at normal levels throughout their whole life, and suddenly they're beginning to reduce. And actually, if we were to adequately replace these hormones, then you would find that a lot of their symptoms went away. Now, if a woman can't have HRT due to various contraindications, then there are other things that a female can do. But if women aren't replaced, the women's depleted hormones aren't replaced sufficiently, then this can lead to some complications, which I'll go on to discuss now. One of them is dementia, also cardiovascular disease, stroke, and osteoporosis. Now, up until the age of 55 or middle age, it's usually men that have a higher cardiovascular risk or risk profile. Yet actually what's not so well known is that once women become perimenopausal and menopausal, then they actually take over and they have a higher risk of developing cardiovascular disease compared to males. And the main killer of women is actually a heart attack or cerebrovascular event, compared to what people think is actually breast cancer, and that's only 5%. And this is where the media and propaganda and health scares are very unhelpful, because it really has set back the females of women's health by decades, by making women not take HRT because of risks of blood clot, the risk or scare around blood clots and cancer, when actually it's these complications here that are far greater risk to them. Now, treatment, there's a number of things that women can do to help manage their menopause symptoms. Obviously, I've alluded to one, HRT, which we'll come on to shortly. But one of the most underestimated treatment plans is just healthier lifestyle. So that might entail eating a diet that is rich in brain-friendly food. And that could be, for example, eggs, oily fish, nuts and seeds, which are rich in polyunsaturated fats, such as omega-6 and omega-3. Eating lots of fruit and vegetables rich in vitamin A, C, and E, which are good antioxidants, which mop up these free radicals that cause internal damage. Calcium, which can be found in broccoli. A lot of people think actually it's milk that contains high amount, but broccoli contains more. And vitamin D. Now that can be through supplements, and I think actually everyone in England, because of Britain, because of the dire sunlight, most people should be on vitamin D supplements. But I have actually read a recent article from one of the top cited scientists, and he was saying that actually if you eat a lot of different varied fungi and mushrooms, they are fortified with vitamin D, and actually they are sometimes more effective and less risky than vitamin D supplements. Another lifestyle hack could be reducing alcohol, and an interesting fact is that a woman drinking 2 glasses of wine a day is at higher risk of developing breast cancer than a woman on HRT. And I really like this fact because it really highlights the stark contrast in the population's opinion of how risky HRT is. And actually this really puts it into perspective of actually alcohol is far riskier, even though a lot of people have it daily and don't really understand the risks behind that. Regular exercise is an obvious one, but probably not done enough. Good sleep hygiene, and also HRT. And that might come in the form of a gel, patch, or pessary. And normally women will need to be put on estrogen progesterone and testosterone. If a woman still has their uterus, then they need to have some sort of progesterone. That can either come in the form of a pill or the Mirena coil. But it is important to know that HRT is not contraception. So it has been known that women on HRT can, and despite being middle-aged, can still fall pregnant. And when I spoke about on the earlier slides some of the symptoms that women can experience and dermatological changes, so it can be the dry and itchiness of skin, but also down in the vaginal area and vulva area, they can get it can be really, really sore, dry, painful. So actually, coupled with HRT, they can also take some local estrogen treatments, as well as vaginal moisturizers and lubricants to help address those symptoms. Yes, these are what I've just talked about, and CBT. So with mental health being such a common symptom of menopause, or certainly a very severe one, that yes, maybe they don't need to be antidepressants, but actually the synergy of HRT and CBT could be a really effective way to address their low mood, anxiety, or what other mental health symptoms they have. Usually then, once they're started on this treatment plan, they should be reviewed and followed up in 3 months' time, have their repeat blood tests, and then they can titrate or calibrate the dosage of the hormones accordingly. So some of the symptoms that cannot be seen, which we touched upon, is the osteoporosis, the thinning of the bones, reducing bone mass density, increasing the likelihood of fractures. And actually, when you get older, if you start having, for example, the fractures such as neck of femur fracture, then the mortality does increase significantly. And yes, well, these are really just another reiteration of the point of these complications that can happen if menopause isn't treated appropriately. So there's cardiovascular disease, osteoporosis, etc. Now, what we're here for really is how does menopause affect women at work? Because women are contributing, well, as it said earlier in that statistic, 51% of women are now in the workforce. So that is a huge amount, or a huge demographic of the work population who are being affected by menopause, hence why this really needs to be addressed and taken seriously. Now, with the poor concentration, poor memory, reduced confidence, low mood, mental health symptoms, physical symptoms, dermatological symptoms, go on and on and on. You've got all these symptoms affecting women in the workplace on a daily basis that go unnoticed or ignored, and this just needs to be addressed properly. Now, why should employers actually support staff during menopause? Well, for a number of reasons. If menopause is treated appropriately, both in work and in the GP, into the medical world, in the hospital, then you'll reduce the staff turnover. You'll reduce the number of sick days, hence reduce the cost of absence, and also reduce the risk of employment tribunals, because menopause is and does fall under the Equality Act 2010. So I know this has been quite doom and gloom thus far, but there is, of course, some things we can do about it. So what can employers do? I'll embellish upon these in the next few slides, but just to go through them now briefly: implement menopause policies, have a menopause champion or someone who is more familiar about menopause that employees can go to, training for HR managers, which is why you're here today. That's a step in the right direction. Making workplace adjustments to the working environment, but also at the home, flexible working, open communication, and open door policy. Okay, so with the workload and flexibility, this is quite an important or key adjustment, because again, with the unpredictability of these menopause symptoms, different women can be affected with different symptoms at different times, and they may even fluctuate throughout the day. So if you maybe got one employee who has symptoms of fatigue worse in the morning, it gets better in the evening, then actually it might be desirable for you to make their working day start later and they just finish later. So actually they're still working at maximum efficacy, just they have that morning hiatus. Sabbaticals, considering changing job content that suits their skill set the best, adjusting their uniform or PPE they have to wear, as we alluded to earlier with some of the very local vaginal symptoms that can be really, really uncomfortable. Actually changing uniform to being cotton-based could be a little bit more comfortable. Home working, as we just talked about, flexible working hours. Now, because menopause is still not spoken about enough and a lot of people are still scared of talking about it, addressing it, then it'd be quite good to be aware of some of the resources that you could signpost your employees and managers too. And this last slide of the presentation lists out a couple of resources that you could direct them to. Changing some of the environment, making some adjustments to the environment, access to cold water, putting desks near open windows or having good ventilation. They get these hot flushes. Quiet room if they have a dip in their mood or real spike in their stress and anxiety. Might be good for them to take a micro break, just take themselves aside, calm down, then go back into the office. And of course, if it's still the employer is still unsure of what more they could do or need some extra support, then of course you can refer them to individuals like myself. And yes, along with the signpost, you could direct the employees to the menopause community, because sometimes it's quite good for employees to feel heard and to not feel alone. They can speak to other like-minded individuals who are going through the same thing. So the HR management training, it's really important for staff to undergo training, because they can then understand, or maybe not even empathize, but sympathize with what their employees, colleagues, or subordinates are going through, so they can help make adjustments and arrangements where needed. And because these symptoms are both sort of physical and mental, you need to be able to create or have an awareness and understanding of the fundamentals of menopause to be able to address the symptoms as efficiently as possible. And yes, to really reiterate the importance of communication. Guidelines and policies. It'd be good to get some of these policies and guidelines implemented into the workforce so that there is signposting available, more awareness, more education out there, and it outlines very clearly the importance of flexibility and optimal working conditions for these employees. They feel heard, and because it's more spoken about and more formal in writing, this will then help the later slides I come on to about the open door policy and communication. They will feel as if probably a bit more comfortable to approach their seniors about it. So the environment, yes, I spoke about this earlier. You want to make sure that the working conditions work for those individuals going through these symptoms, and to make sure that their current working desk environment isn't actually exacerbating the situation. And it must be individualized. Maybe some women get really, really, really hot, so they need that desk fan, open ventilation, but there's no point putting aircon on at really, really low, because then you might have some individuals who actually their menopause symptoms are being freezing cold, have to wear coats inside. So again, trying best as possible to make reasonable adjustments to the individual. Communication, this is really, really key, because it invites unity, reduces division, and it creates that sort of open door policies that if any employees are struggling because of the menopause, they really feel as if they can openly communicate with their colleagues, line managers, and above. With communication, of course, comes the delicate use of the right vocabulary, being respectful, encouraging, and mindful of what they're going through, even if maybe you're male, so won't go through it, or of a certain age of a female, you haven't gone through it yet. Just having more awareness about it will help facilitate that communication. The importance here, you're getting men involved, because again, you don't want to encourage that polarization or division within the workplace. So by getting men involved, them being educated and taught about what menopause actually entails, why it happens, the symptoms they experience, it breaks down those perceived barriers. It hopefully makes it less a taboo to speak about, and also allows all emotions to be aired. But yes, again, it's all about being careful with the language used, being respectful. Okay, this is, I suppose, more specific to employees, but still useful nevertheless, that it might be worth or useful for the line manager to have an employee that approaches them who have written down a list of the symptoms they're experiencing, and it might even be sort of a diurnal pattern, as I said in the prior case study, that symptoms might be worse in the morning or equally vice versa in the evening. So working around that, and as the line manager on the receiving end, it's being open to some suggestions, working with the employee to work out the best strategy and the best workplace adjustments that will suit their needs the most. And throughout the whole meeting, it's best to be solution focused. Okay, so the open door policy. With the menopause champion, they might be a designated contact, so they might have gone on this course, for example, or attended other webinars and have a great understanding the most about how menopause affects women in the workplace. And if they're made to be well known amongst the workforce as the person to go to, then employees might feel more comfortable approaching this menopause champion rather than their line manager. And then maybe it might be up to the menopause champion to dissipate this information to the line manager to get this sort of open communication going. And that way it helps develop trust, build relationships, and really just overall creates a more effective, cohesive workforce. Yes, this open door policy will encourage women to share concerns with colleagues and managers to make them aware of how they're being impacted by their symptoms. So lastly then, with the employment tribunals and menopause, it does fall under the Equality Act. The lawyers have suggested that women have more increasing empowerment to challenge employers where these issues are encountered. And as I said earlier, that women are contributing to a huge amount to the workplace. And so if these women are having to leave the workforce early, then there's really something we can do about it to boost UK GDP and even just on a micro scale, the organisations themselves. And if this isn't addressed, then this number will only increase. At the moment, about 1 million leave their work post-menopause, and this really, hopefully going forward, will reduce as awareness increases. So on a final note then, just some quick takeaways from this whole talk, that we really want to address the stigma, get people talking, educated, using the right language, being respectful, and having that open door policy. This does definitely include men in the conversations as well, because if everyone's aware of what's going on, then that just creates, again, a more cohesive working force. Internal campaigns, policies, guidelines, signposting, resources, menopause community, there's so much out there that we can engage with and to help employees feel listened to and heard. Internal support structure with a menopause champion. Going forward after this webinar, it might be worthwhile notifying the employees of what changes are to come, so that, again, when these guidelines and policies are enforced, everyone's made aware of what's going on. Look at what environment, workplace adjustments. And lastly, definitely do bear us in mind if you hit a brick wall or not too sure how you can help employees, you send them to an occupational health physician. As promised, this last slide is about the different resources out there that can help managers signpost their employees for more information. And that a really good app is called the Balance app. There's one called Happy Place that Fern Cotton created. And I know there's a huge movement after Davina McCall launched her book about it. So yes, there's plenty of help out there. Women just need to be directed to the right places. Brilliant. So thank you very, very much for listening to this webinar. Any questions, just follow it up with an email to Insight, and I'll do my best to address them. And if I can't answer them, then I'll probably be directing you towards the Balance app or Newsom Health, which is a really, really good website as well. Well, have a lovely day, and yeah, thank you very much.